Most people think type 2 diabetes begins the day they're diagnosed. In reality, it's one of the most misunderstood diagnoses in modern medicine. For many people, it feels sudden. One blood test, one number, and one word, diabetes, that instantly carries fear, guilt, or uncertainty. But biologically, type 2 diabetes is almost never sudden. It is usually the visible endpoint of a long, quiet process that has been unfolding for years, often decades before anyone even notices. And that misunderstanding affects how people approach treatment, lifestyle changes, and what they believe is possible. In this video, we'll talk more about how type 2 diabetes actually develops, why diabetes makes more sense when you look at it through an evolutionary lens, when reversal might be a realistic goal versus when it's unlikely, and where medications fit into the picture. This isn't about blame, it isn't about perfection, and it isn't about fear. It's about understanding what's happening in the body and what can realistically be changed. Type 2 diabetes doesn't start with high blood sugar. It starts with insulin resistance. For years, the body becomes gradually less responsive to insulin's signal, particularly in the liver and muscle. In response, the pancreas compensates by producing more and more insulin to keep blood sugar levels in the normal range. During this phase, fasting glucose can look normal, A1C can be normal. Standard screening labs might look fine, but insulin levels are often chronically elevated. This state can persist for a very long time, quietly and invisibly, because insulin is extremely effective at keeping blood sugar under control. Eventually, though, compensation reaches its limit. The insulin-producing beta cells in the pancreas become stressed, dysfunctional, and over time begin to fail. Only then does blood sugar start to rise, and only then do we apply the label or diagnosis of type 2 diabetes. The diagnosis is not the beginning of the disease. It's the moment the body can no longer hide it. To understand why type 2 diabetes is so common today, we need to zoom out. For most of human history, food was scarce, calories were unpredictable, and survival favored energy storage. In this context, insulin resistance was not a flaw. It was an adaptive advantage. It allowed for efficient fat storage, preservation of glucose for the brain, or survival through times of famine. But evolution optimized us for intermittent abundance, not constant surplus. Modern humans live in perpetual caloric availability, refined, rapidly absorbed carbohydrates, minimal physical demand, chronic stress and sleep disruption, and no natural fasting periods. Our biology hasn't changed. Our environment has. Type 2 diabetes is not a personal failure. It is a predictable outcome of an ancient metabolic system placed in a modern world it was never designed for. One of the most important things to understand about type 2 diabetes is that the diagnosis doesn't represent a sudden biological change. Instead, glucose regulation exists on a continuum, which includes normal insulin sensitivity, insulin resistance with normal glucose, impaired glucose tolerance, early diabetes, and advanced diabetes with complications. These aren't separate diseases. They are different points along the same trajectory. That distinction matters because where someone sits on that spectrum influences both treatment decisions and what outcomes are realistic. It also explains why early intervention is so powerful. The earlier you intervene, the more intact the system still is. A critical piece of this story is what's happening inside the pancreas. The pancreas contains beta cells, which synthesize and secrete insulin in response to the body's blood glucose levels. Early in the disease process, beta cells are often dysfunctional but not dead. They're overwhelmed by chronic insulin resistance, high glucose exposure, elevated fatty acids, and inflammatory stress. This phenomenon is collectively referred to as glucolipotoxicity, or nutrient-induced metabolic stress, which is a very long way of saying the pancreas has been working overtime for years and it's starting to show. This is why early diabetes can sometimes go into remission with lifestyle changes rather than medication. This is also why glucose levels can also normalize with lifestyle changes. And this is why medication requirements can decrease or disappear. However, with longer disease duration, beta cell loss becomes structural. Some cells are lost permanently. This is the point at which diabetes becomes less reversible, even if insulin sensitivity improves. This distinction is essential. When remission doesn't happen, it's not because someone didn't try hard enough. It's because biology has limits. The word reversible gets used carelessly in diabetes discussions. So let's be precise. Insulin resistance is highly reversible, especially when it's driven by things like visceral fat, fatty liver, physical inactivity, and chronic hyperinsulinemia. Reducing liver fat alone can dramatically improve fasting glucose. Improving muscle insulin sensitivity through resistance training increases glucose disposal independent of weight loss. These changes can be profound. However, loss of beta cell mass in the pancreas is only partially reversible. Early dysfunction may recover. Established cell loss does not. This is why remission is a spectrum as well, not a guarantee. And it's why long-term management sometimes still requires medication, even with excellent lifestyle habits. Somewhere along the way, medications got rebranded as giving up. I'm not sure who started that, but they were wrong. Medications are tools. Different classes of medications target different parts of the disease. For example, by reducing glucose production, improving insulin sensitivity, or increasing insulin secretion, or lowering appetite and energy intake, or by improving weight regulation. Used thoughtfully, medications can reduce metabolic stress, protect remaining beta cell function, lower the risk of complications, and buy time for lifestyle changes to work. They are not a substitute for healthy lifestyle habits, but they are also not an admission of defeat. For many people, medications are what allowed progress to happen safely and sustainably. In the future, we will have a dedicated video discussing one of these medications further, specifically GLP-1 medications. However, if you would like to see a video reviewing other classes of diabetic medications, comment below to let me know. One of the most frightening aspects of diabetes is the fear of complications. If diabetes is not adequately managed, long-term complications can include cardiovascular disease such as heart attacks or strokes, chronic kidney disease, also referred to as diabetic nephropathy, vision loss or diabetic retinopathy, peripheral neuropathy, autonomic neuropathy, peripheral arterial disease, foot ulcers, increased risk of infection, and more. But complications don't arise simply from just having diabetes. They arise from chronic exposure to high blood sugar, which slowly damages those small blood vessels over time. That reduces blood flow and impairs tissue health. That slow, cumulative injury underlies most diabetic complications. This is why early diagnosis, management, and early improvement matter so much. Lowering average glucose, even without achieving perfection, dramatically reduces the long-term risk. Progress matters far more than perfection. The goal of diabetes care is not chasing perfect numbers. It's restoring metabolic resilience. That means lowering insulin resistance, reducing glucose exposure, preserving remaining beta cell function, preventing complications, and building habits that are sustainable for decades. Some people will achieve remission. Some will need ongoing medication. Many will land somewhere in between. All of those outcomes can still represent success. Medicine rarely gives you clean, tidy outcomes. Biology, unfortunately, didn't read the textbook. Type 2 diabetes is not sudden. It is not binary. And it is not a moral judgment. It is a chronic metabolic condition that develops slowly over time and can often be improved over time as well. Understanding the process gives you leverage, and leverage is what creates meaningful change. If this video helped you understand type 2 diabetes a little more clearly, consider subscribing. I post long-form videos like this every week, focused on evidence-based explanations of metabolic health, without fear, blame, or oversimplification. And if you know someone who's been diagnosed with diabetes or struggling to make sense of it, sharing this video might help more than you think. I'm the Science MD, and this is the science behind your health. Thanks for joining, and see you next time.